Hello, my name is Ella Stokes. This is my portfolio video for HIMT 2460.
I like Health IT because I believe it will improve the quality, safety, and care that we as patients deserve.
Because it's an incredible opportunity to improve patient safety for all Americans.
It has meant a major change in my life, my professional career, and how I can practice medicine.
I like Health IT because it is what we need to help people all across our state achieve their full potential.
Because it can help make the care that all of our patients receive in this country better.
Because it's transforming the way that we provide care.
I like Health IT because of the difference it can make in the quality of care that we provide the people of our country in improving the overall health and well-being of the American people.
I like Health IT because it will finally bring innovation to a field where we desperately need it. And best of all, it will help me play a more active role in taking care of myself and my family.
I like Health IT because it's going to improve the quality of care, it's going to expand access to care, and it's going to make care more affordable not only in Maryland, but in our country.
The person I interviewed from the HIT field was Megan from the Eagles Landing Family Practice Business Office. Megan is a billing representative. She's attending school now as a nursing student, working in her core classes. She started working in the HIM department in 2010 in data entry. A few years later, she moved into insurance, handling insurance and denials. Some of her job duties include verifying billing information, verifying insurance, and handling denied claims. Some of the challenges that she faced are the updates and changes in insurance and benefits, the guideline changes, and patients. Patients have a hard time understanding payments and why they are being billed for things. Improvements that can make her job easier is more training in coding and billing. Her expectations of the new ICD-10 implementation: she thinks it would be a little difficult to handle at first, but will be very helpful to billing and insurance once they get the hang of it. I attended a CMS webinar on June 18th. It was on ICD-10, preparing for implementation, and new ICD-10 PCX Section X codes. One of the main things I learned was how a company needs to prepare for ICD-10 implementation. First, they need to make a plan. Review their super bill and their profit management system. Second, they need to train their staff. Documentation and coding training. Third, they need to update their processes. Look internally. Review their cost reform, their policies, and their procedures. 4, talk to your vendors and payers. Engage them in the readiness discussion to make sure you are all on the same page as far as moving forward. And number 5, test your system and processes. Work with your vendors to test your internal system to make sure things work properly. Review your test results to make sure you are getting back what you are expecting. I also learned that there are many different resources available for ICD-10 implementation. There's a Road to 10 program available online for on-site training, where they also have interactive case studies available for you to practice on. There is also a lot of videos available on ICD-10 and on clinical conditions. Another thing I learned from the CMS webinar is the new PCS X codes. 36 new procedure codes were created, 14 were X codes. X codes are unique codes for new technology. They are used for hospital claims, inpatient hospital procedures, and these are standalone codes. They use the same root operation value as their closest counterparts in other sections of ICD-10 PCS. You don't have to learn new root operations to find the code. And also, if you want a new code or a code to be revised or deleted, you make that request to the ICD-10 Coordination and Maintenance Committee 2 months prior to their September meeting. My strongest core areas will be medical terminology, anatomy, and revenue cycle management. I am very familiar with the many different types of insurance available today and how to file claims. I also understand the different CMS reimbursement methodologies. One of my weakest areas is coding and CPT codes. I'm not very familiar with coding rules and guidelines. I feel you need to know them very well to become a true expert in coding. How to overcome my weaknesses. Try to dedicate an hour every day reviewing for the RHIT exam. Familiarize myself with the ICD-10 coding guidelines. Attend training sessions on ICD-10 coding. Practice coding problems online and in my workbook. Review the information in my Health Information Technology Management book. Take RHIT practice exams online. And probably try to have a 2-hour study session with recent classmates at least once a week. And most importantly, I should never give up. One of the areas that was very interesting to me was the legal aspects of healthcare, the patient privacy laws. I feel it's very important for a healthcare facility to effectively maintain the privacy of patient information. Patients feel more comfortable knowing they can share their information without the threat of their information being leaked to the public. I was also interested in the medical billing, insurance, and coding. It was interesting to know because it's a major part of the HIT profession, involving the administrative financial side. In order for healthcare facilities to be successful, accurate billing and coding must be administered. Here are my suggestions for program improvements. Reorganization of the coding classes being taught. The first coding class should only include the learning of rules and guidelines. The program should include a PCS HitPix class and more face-to-face interaction. Should not only include classroom settings, but also outside externship training as well.